Hi, classmates. It's Lakendria. So, I am going to do a caregiver education video on sickle cell disease. So, hello, my name is Lakendria. I'm a student nurse. Today, I will provide education about sickle cell disease. My goal is to help you understand this condition, recognize warning signs, know when to seek medical care, and learn how to care for your child at home. And then I did just a little background about what sickle cell disease is. It's an inherited blood disorder that affects the shape of and function of your red blood cells. Normally, the red blood cells are round and flexible, allowing them to move easily through the blood vessels and carry oxygen throughout the body. In children with sickle cell disease, red blood cells become hard, sticky, and crescent shaped. These cells can block blood flow, causing pain, tissue damage, and decrease oxygen delivery to organs. All right, and then some of the signs and symptoms that you want to watch out for is pain, crisis, fatigue, weakness, pale skin, swelling of the hands and feet, jaundice, fever, shortness of breath, and delayed growth. Possible complications include vaso-occlusive pain crisis, acute chest syndrome, stroke, severe infection, splenic sequestration. Sorry, I can't pronounce that. Sequestration. Okay, and long-term organ damage. All right, when to seek medical care. Seek emergency care if your child develops a fever of 101 or higher, chest pain, difficulty breathing, severe pain not relieved by medication, sudden weakness, difficulty speaking, persistent vomiting, severe abdominal swelling, unusual sleepiness, or an erection lasting longer than 4 hours. Some medications that your child will be taking will be hydroxyurea, reduces sickling and decreases pain crisis and acute chest syndrome. Side effects may include low blood cell counts, nausea, mouth sores, and loss of appetite. Young children are often prescribed penicillin to prevent serious bacterial infections. Side effects include diarrhea, rash, allergic reactions. Pain medications such as acetaminophen, ibuprofen, or prescribed opioids may be used during the pain crisis. Side effects vary and may include stomach irritation, constipation, drowsiness, or liver injury if taken incorrectly. Family-centered care. As the caregivers, they can encourage adequate fluid intake, giving medications exactly as prescribed, ensuring routine vaccinations, avoiding exposure to illness, recognizing early symptoms, keeping follow-up appointments and using the teach-back method to confirm understanding, keeping a record of pain episodes, medications, and hospital visits to help healthcare providers individualize care. All right, and then I have a little teach-back that I wanted. Gotta get to it. Okay, so my teach back. Before you leave the hospital, I want to make sure I explained everything clearly. Can you tell me in your own words what sickle cell disease is? And why do pain crises happen? What signs and symptoms would you call your healthcare provider? What symptoms will require emergency department right away? And how and will you give your child's medication such as hydroxyurea or penicillin prescribed? And what are some things you can do at home to prevent complications? If anything is unclear, that's okay. I will explain it again and answer any questions you have. My goal is to make sure you feel confident caring for your child at home. Remember, you are an important member of your child's healthcare team, and your observations and actions can help prevent serious complications and help your child stay healthy as possible. Thank you. Bye.